The Irish Cancer Society is the national cancer care charity. Established in 1963, our flagship services are our nursing services, which are available free of charge in hospitals and communities across the country to people with cancer and their families at every stage of the cancer journey. It is estimated that 30,000 new cases of cancer will be diagnosed in Ireland this year, and any diagnosis of cancer obviously has a profound effect on patients and their loved ones. We fund 14 oncology liaison nurses in our major cancer treatment hospitals. These nurses work as part of the hospital cancer care team, providing emotional and practical help to patients and their families at the difficult and sensitive time around the diagnosis.
I meet the patient, if possible, when they're initially diagnosed or when they initially come to see the oncologist. I'd follow them through their treatment and afterwards throughout their clinic visit. So you're there as someone that they've met from the very start. It's a familiar face in a very unfamiliar time.
Our National Night Nursing Service has been in operation since 1986 and now offers up to 10 nights of care, free of charge, to people who are at the advanced stage of their illness and wish to remain at home, surrounded by their family and friends.
All of us would like to be at home in our own homes for the last days of our lives. So with the care and with the help of the night nursing and the home care team, this can be provided. It's a very frightening time for families, especially this may only happen them once in their lifetime. Nobody wants to lose a relative, and the process of dying sometimes can be very traumatic. So with our professional help, we can actually make it easier for them. We can let them know what's going to happen, and this sometimes reassures them quite a lot.
The Society provides financial assistance to home care teams of specialist palliative care nurses who work in the community in conjunction with local family doctors and public health nurses to provide vital specialist care and support to patients with cancer in their own homes during the day. We are keenly aware of the constant need to encourage greater numbers of nurses to specialise in cancer nursing. This has been achieved by funding a clinical nurse tutor and providing educational grants to nurses to undertake the postgraduate diploma in cancer nursing. Upon their graduation, the Irish Cancer Society presents each nurse with a handmade silver brooch, which they will wear while providing a highly specialised standard of care in hospitals and communities all over Ireland. We are also committed to the continuing education of non-specialist nurses who care for cancer patients in general hospitals and communities and support a 5-day free educational programme to enable the nurses on its completion to provide quality holistic care for cancer patients. Our Cancer Information Service now comprises a walk-in caller and email facility and interactive help online through our website cancer.ie, as well as our long-standing National Cancer Helpline, which receives almost 22,000 calls a year. The Cancer Information Service is staffed by specialist cancer nurses, working each day to meet the ever-increasing demand for free confidential information and advice for anyone worried about any aspect of cancer prevention, diagnosis, treatment or care. This includes providing grants to patients who are experiencing financial difficulties as a result of their diagnosis. We also run 2 specialist programmes called Action Prostate Cancer and Action Breast Cancer. In 2008, the Irish Cancer Society decided to extend their Cancer Information Service into hospitals around the country, providing information to patients, relatives and the general public at the point of diagnosis and treatment by opening daffodil centres, which are staffed by cancer nurses and supported by trained volunteers. Children, in particular, need extra help coming to terms with their feelings at the time of a cancer diagnosis. We fund a play specialist in Our Lady's Hospital for Sick Children in Crumlin. This service provides specialist diversion and development therapy for children, thereby substantially improving their psychological response during treatment. Thanks to advances in cancer diagnosis and treatment, the prognosis is improving all the time. And today, more and more people go on to lead normal lives. However, whatever stage of the cancer journey someone is at, We are there to support them and ensure that they are surrounded by expert, sympathetic healthcare professionals. Thank you for listening to What We Have to Say.